Imagine you've just been dragged into a smoky, flea-ridden medieval barber's shop, your arm split open from a cart accident, or maybe a rusty blade. You're dizzy from blood loss. The air reeks of sweat and rotting teeth pulled earlier in the day, and you pray this man with dirty hands and a blood-stained apron knows what he's doing. You expect a cloth, maybe a bandage, a prayer muttered under breath. Instead, the barber steps closer, lifts his robe slightly, and begins to urinate directly onto your wound. Because in medieval Europe, this wasn't some bizarre punishment or a humiliating joke. It was medicine. They believed that urine, warm and steaming fresh, was one of the best ways to clean a wound. It wasn't a fringe, back alley practice whispered about in terrified rumors. It was everyday medical reality for peasants and soldiers who couldn't afford the fancy wine or imported vinegar the wealthy might use for cleaning cuts. It was part of the chaotic mess that was medieval healthcare, where leeches and cauterizing irons shared space with warm streams of pee, meant to wash away the dirt and infection in an age when people didn't even know what germs were. The logic made sense to them. Urine was a bodily fluid, part of the grand design of humors flowing through the body. And if the body made it, surely it couldn't harm you. It was believed to be sterile, warm, and able to flush out the bad blood and corruption seeping from an injury. And so, in the corner of a filthy barber's stall, in castles after battles, or on the side of a muddy road, men and women who could afford no better found themselves cleaned and blessed with the warm, acrid stream of medieval antiseptic, hoping that it would save them from death's shadow, waiting at the edge of every wound. For them, it wasn't a nightmare. It was hope, delivered one humiliating, steaming moment at a time. In medieval Europe, if you were too poor to see a real physician, and most people were, you went to the barber. But don't let the striped pole fool you. These men were far more than hair trimmers. They were the barber surgeons, the everyday medics of the medieval world, the ones who would pull your rotten teeth, lance your festering boils, stitch up your torn flesh after a brawl, and, yes, pee on your wounds if that's what it took. The barber's shop was a brutal hybrid of hair salon and surgery chamber, with the smell of blood and lye soap mixing with the metallic scent of razors that sliced both beards and flesh. They were the bloodletters of the street, draining pence from patients in the belief it would balance the humors. They were the quick surgeons who would hack off a gangrenous limb with a saw still sticky from the last unfortunate soul, wiping it down with a rag that had seen better centuries. The iconic barber pole, still seen today, tells the story of their grim dual role. Red for the blood they let, white for the bandages that wrapped the wounds they left behind, swirling together in a silent dance of medieval medicine. Some poles even had brass leeches hanging from them, signaling to the public that this was the place to go if you needed to be drained or cut. Their tools were simple and deadly dull knives, saws, razors, and dirty rags. Boiling water was rarely used to clean them. They would often wipe the blade on their aprons and continue. They reused their instruments on patient after patient, dragging infection from one open wound to the next without a thought, because the concept of germs was as foreign to them as flying machines or electricity. And yet, despite the filth and the pain, the barber was the best hope many had. A wealthy lord could pay for a university-trained physician, but the farmer, the soldier, the street vendor, they turned to the barber, who would stitch their wounds, pull their teeth, set their bones, and when infection threatened, pour urine on the gash to keep death at bay. It was medicine born out of necessity and ignorance, a mix of superstition and genuine attempts to help. In a world where a simple cut could turn into a death sentence, you didn't care if the cure was humiliating, painful, or disgusting. You just wanted to live. And so you trusted the barber standing beneath the red and white pole, ready to take your blood, cut your flesh, and save your life in the only ways they knew how. Why urine? Why would medieval barbers and surgeons choose something so foul, so humiliating, so human, to treat wounds? Because in their world, urine was medicine. Medieval medical practice was rooted in humoral theory, the belief that the body was governed by four fluids: blood, phlegm, yellow bile, and black bile, and that illness came from these humors being out of balance. Heat, moisture, dryness, and cold were the elements used to balance them, and urine in their minds contained heat and moisture, making it a cleansing and healing fluid. Urine was also widely believed to have natural antiseptic and cleansing properties. It was warm, sterile, at least initially, and free. An important consideration when you lived in a world where medical supplies are scarce, expensive, or simply did not exist. If you couldn't afford wine or vinegar to pour into your wound, you could at least count on your barber, or yourself, to provide a warm stream of medicine. And it wasn't just wounds. Pee was used for ear infections, dropped directly into the ear canal to flush out evil humors. It was used to treat mouth infections and sore gums, swished around like a grotesque medieval mouthwash. Recipes from medical manuscripts suggested using stale urine to wash wounds, believing it would prevent bad blood from corrupting the flesh further. Some healers even prescribed drinking one's own urine to treat certain ailments, believing it recycled the body's own essence to restore health. Urine's medical value went beyond treatment. It was central to diagnosis through uroscopy, the art of urine analysis. Physicians would collect a patient's urine in a clear glass flask, holding it up to light, swirling it gently, and observing its color, cloudiness, and sediment. They believed the urine's appearance could reveal the state of the patient's health, from fevers to liver issues, or even predict death. Detailed urine charts were common in medieval medical texts, helping doctors interpret the shades of yellow, red, or brown like a mystical code to unlock the body's secrets. In a world without germ theory or modern hygiene, the logic made sense. If the body expelled it, it must be part of the body's cleansing system, and thus could help cleanse the wounds that threatened life. They did not see it as disgusting. They saw it as practical, spiritual, and medical, an extension of the body's natural healing. And so, while we today gag at the thought, for medieval barbers and patients, urine was a warm, immediate, and surprisingly comforting hope against the black shadow of infection and death. Because when the world offered no soap, no antibiotics, and no understanding of microbes, pee was better than nothing. And for them, nothing was the alternative. Imagine it's a cold morning, the ground damp with mud and manure, and you've just gashed your leg open on a splintered cart wheel. Blood seeps down your calf, mixing with the filth on the street, and you limp to the local barber, surgeon. Your only hope between you and the slow rot of infection. You step into the shop, the air thick with the coppery tang of old blood, the sharp stink of sweat, and the heavy, rancid odor of unwashed bodies. Dried streaks of blood stain the wooden table where patients lie, and buzzing flies crawl lazily over blood-caked sores and knives. This is where healing happens. The barber glances at your wound, wipes his filthy hands on his apron, and pulls out a blade still sticky from the last patient. No soap. No boiling water. Just a quick wipe with a rag that smells of old iron and mold. He cuts the wound wider to clean out the dirt and clotting blood. The pain blinding. Your scream blending with the groans of another patient, having a tooth ripped out in the corner. Then comes the medicine. If you're lucky, he has a jar of stale urine collected from himself, apprentices, or the chamber pots out back. If not, he will simply stand over you, pull up his robe, and urinate directly onto your open, bleeding wound, the steaming, acrid warmth hitting the raw flesh, with a sting that sends your mind spinning. The urine drips down, flushing the wound of blood and dirt. Or so he says. The smell is choking, the humiliation complete. But in this world, dignity has no place. If you survive, that is all that matters. In some cases, they believed young boys' urine was the purest and most effective. Less corrupted by bad humors, and so children were made to relieve themselves into jars, which were kept behind the barber's bench. Lids crusted with dried drips, ready to be poured onto the next gaping cut. Once the wound is well soaked, the barber takes a strip of dirty linen, reused many times, stained brown and red from past patients, and ties it around the wound. No clean bandages, no antiseptic. Just rotting cloth pressed into the fresh cut. Sometimes they would sprinkle herbs or spider webs into the bandage if they had any. But often, it was just the wound, the urine, and the rag. The patient, trembling, would be told to keep it covered and return if fever or swelling came, which often did. Many wounds festered despite the urine treatment, the stench turning worse as infection set in, the flesh around the bandage blackening, and the veins darkening with poison. But for some, the wound would scab over, and they would believe the barber's method had worked. In a world without antibiotics, without understanding germs, with death waiting in every cut, people accepted this foul ritual as the price of survival. To them, the warm sting of urine on a wound was a promise that they might see another day. And so, in the shadowed blood, slick floors of medieval barber shops, urine became medicine, poured over wounds by trembling hands, steaming in the cold air, washing away blood and dirt under the watchful eyes of death himself, waiting patiently in the corner. Because in a world where the only other option was to let a wound fester and kill you slowly, the humiliation of being pissed on was a small price to pay for another sunrise. Did it work? Well, in the twisted, plague-ridden world of medieval medicine, urine actually wasn't the worst idea they ever had. Urine contains urea and a small amount of ammonia, which can help clean wounds, kill some bacteria, and prevent infection, in theory. Fresh urine is sterile when it leaves the body, and it does have a mild antiseptic effect, compared to rubbing dirt, dung, or rotting meat on wounds, which some folk remedies suggested. Urine was practically advanced medical technology, but here's the problem. They poured that clean urine onto wounds with filthy hands, using knives crusted with dried blood, in rooms where the floor was layered with months of gore, spit, and fleas. The rags they tied around wounds after the urine bath were rarely washed, and when they were, it was in cold water from a communal bucket that likely contained more bacteria than the wound itself. They didn't understand germ theory or that infections are invisible, crawling silently into cuts, even if the outside looks clean. They didn't know that bacteria from the barber's hands, or from the flies buzzing around, could turn a small cut into a death sentence. And while the pee may have helped a tiny bit in cleaning the wound, it was never enough to offset the horrifying conditions in which these treatments were done. If you were lucky, your immune system fought off infection despite everything. If you weren't, your wound would swell, darken, and rot, the smell of decay leaking from beneath the bandages as you slipped into fever and delirium. Humorously put. Sure, it might clean a cut, but so would soap, which they rarely used. Soap was expensive, and water was feared for carrying disease. Meanwhile, the barber was perfectly comfortable peeing on your leg, but wouldn't think to wash his hands before cutting into your flesh. In the end, urine was a desperate solution in a desperate time. A moment of crude hope against the very real terror of infection in a world where even a scratch could end your life. It might have bought a few people extra days, but it was far from the miracle cure medieval barbers believed it to be. In the grimy alleys and bustling market squares of medieval Europe, the idea of having someone pee on your wound wasn't seen as bizarre or humiliating. It was normal, just another part of the brutal lottery of survival in a world where every cough could mean plague and every cut could mean death. People didn't recoil in disgust the way we would today. Most were too busy trying to survive, and the concept of cleanliness was entirely different in a world where bathing, work chamber pots were emptied into the street, and the stench of rotting refuse was inescapable. If the barber told you that warm urine could save your leg, or your life, you didn't argue. You grit your teeth and let it happen. Meanwhile, the wealthy had options. A knight, a lord, or a well-off merchant might have a physician pour wine or vinegar over their wounds, considered a more refined antiseptic at the time. Vinegar's acidity and wine's alcohol content could indeed help clean wounds, and while it still burned like hell, at least it didn't involve someone dropping their trousers over your fresh cut. But for the average peasant, urine was free. It was always available, didn't cost a single coin, and was seen as a reasonable, practical solution. In a society where people often bartered for goods and struggled for every meal, the value of a free treatment could not be overstated. And let's be honest, if medieval people had memes, the caption would have been, "Medieval healthcare pray, bleed, and get peed on." Because that was the system. You prayed to avoid illness. You bled to balance your humors. And if you were lucky enough to find help for your wounds, you got peed on. All of this was done with a straight face by barbers and healers who truly believed they were helping, and by patients too desperate to care about dignity when death was hovering at the edge of every infection. In a world of leeches, cauterization with red, hot irons, and herbal poultices mixed with animal dung, urine was almost merciful. It was a gross, smelly, humiliating mercy, but a mercy nonetheless in the bleak theatre of medieval survival. If you think getting peed on was the worst medieval medicine had to offer, think again. For those who could afford it, wine or vinegar was the antiseptic of choice. It wasn't just about cleanliness, it was about class. Wine was expensive, and using it to clean wounds was a sign of wealth, like flashing a gold ring while your barber dribbled Bordeaux onto your gash. Vinegar, sharp and acidic, burned like fire, but could clean wounds reasonably well. Though people didn't understand why, only that it sometimes seemed to work. But if you weren't wealthy enough for wine or vinegar, there was cauterization. Imagine a wound festering, red and swollen, leaking pus in the warm, medieval summer air. The barber would take an iron rod, heat it in the fire until it glowed orange, and press it directly onto your wound, searing flesh with a hiss and a scream that likely echoed down the street. The theory was simple: fire purifies, and burning the wound would stop bleeding and infection. In reality, it often created worse wounds, deeper infections, and unimaginable pain. But at least, they thought, you weren't bleeding anymore. Then there were herbal poultices, a seemingly gentler approach. Healers would mash herbs, garlic, rosemary, sage, and even moldy bread, into a thick paste and slap it onto wounds, wrapping it in cloth. Sometimes it helped. Garlic has natural antibacterial properties, and moldy bread could, by sheer luck, introduce penicillin-producing mold. But medieval healers didn't know that. They were just throwing nature's kitchen sink at infections, hoping something would stick. And then, the truly bizarre spider webs and animal dung. Spider webs were believed to help clot blood, so they were packed into wounds. But they often came with dirt and insect parts that made infections worse. Animal dung, believed to draw out bad humors, was smeared onto wounds in some folk practices, introducing bacteria directly into open cuts and sealing a patient's fate. Compared to having boiling tar poured onto a wound, or a red, hot iron shoved into your flesh, a warm stream of urine almost seemed merciful. It was humiliating, disgusting, and smelled like the back alley of a tavern. But it wasn't fire. It wasn't dung. It wasn't the scream-inducing agony of cauterization. In a world where medical care meant deciding whether you wanted your wound to smell like pee, burn like the pits of hell, or rot under a smear of manure, urine seemed like the lesser evil. It was the cheapest, quickest, and most immediate option in a medieval nightmare, where every cut was a gamble with death, and survival came in the form of desperate, sometimes revolting measures, because when death is knocking, dignity doesn't matter. And in the medieval world, there was no dignity in healthcare, only survival. In the end, medieval medicine was nothing but a desperate dance with death, a grim guessing game played in smoky huts and blood-streaked barber shops, where every cut could become a coffin, and every cough could be your last. They didn't have antibiotics, soap, or knowledge of germs. They didn't know that a filthy rag could kill faster than the blade that caused the wound. They didn't know that infection was a hidden army crawling invisibly beneath the skin, turning wounds black and feverish until the body gave out. So they tried everything. They bled people with leeches, hoping to drain sickness out with their blood. They burned wounds with hot irons, believing fire would drive away corruption. They packed wounds with herbs and moldy bread, trying to coax out the poison. They smeared dung, stuffed spider webs into cuts, and prayed to saints. And yes, they poured warm streams of urine onto wounds, believing it was the best hope against infection, because in their world, it sometimes was. What looks to us like pure madness was, for them, survival. They used the tools they had, the beliefs they clung to, and the bodies they could sacrifice in the name of trying to live one more day in a world where death waited around every corner. It's easy to laugh, to cringe, to feel disgusted. But under that disgust lies a truth. These people were just like us, terrified of dying, desperate to live, doing whatever they could with what little they had, even if it meant enduring the humiliation and stench of having someone pee on your wounds. Because to them, that humiliation was worth the chance of seeing another sunrise. History is strange. History is cruel. History is dark. And sometimes it's gross, too. And above all, history is dark, and we must remember it.